Psychiatry. This is the first video in a series that I'm doing looking at patient-directed overviews of commonly prescribed medications in psychiatry. The first medication I'd like to talk about is one that's been around for about 3 decades, and that is fluoxetine or Prozac. Like I mentioned, it's been essentially the gold standard treatment for depression and anxiety over several decades. Basically took over from the tricyclic antidepressants when it came to market, largely because it was so easy to dose and well tolerated compared to the rather cumbersome titrations that were needed with some of the older medications. So what do we use Prozac for? It is a selective serotonin reuptake inhibitor, and there are several other medications in this class. They are generally the gold standard medications for treating depression and a multitude of anxiety disorders. Prozac is very well studied in a lot of special populations, which gives a lot of data if you, for instance, are in pregnancy, breastfeeding, post-cardiac, very young. There's generally more data with Prozac than some of the other agents, largely because it's been around for so long. So how do we dose Prozac? Prozac is a once-a-day medication, has a very long half-life, which can be an advantage in certain populations. For instance, if you're a person that just can't remember to take it every day, Prozac has you covered in that respect. Some of the other agents can have some discontinuation symptoms because of their shorter-acting nature. Prozac is fairly activating, so we typically dose that in the morning. I like to go on the lower end of dosing. It is a capsule, so you can't break it, so oftentimes we'll start with a 10 milligram capsule in somebody that's maybe naive to the medication or a younger age. As I do this more and more, I tend to gravitate to lower dosing for most people. As I noted, it is activating, so you take it in the morning. Insomnia can be a common side effect from Prozac because of its activating nature. You do have to swallow it. There's a lot of serotonergic receptors in our GI system, so they can get a little activated initially. Those symptoms typically subside, as do mild headache. As with any medication, you can look at the information on it and see a litany of side effects, but those are sort of the more common ones that we may run into. There is sexual side effects associated with serotonergic medications. Prozac's not immune to that. I bring that up because it's commonly not discussed with physicians, and it really needs to be because it is a major reason why people may stop these. Prozac's been around a long time. It's a generic, so it's very inexpensive. So if you're going in and out of different insurance programs where you maybe don't have coverage, it's often available for $4 at most pharmacies. It has been around a long time. It's been a good medication. As with all of the serotonergic SSRI medications, in a fair fight, they're about the same with respect to efficacy. It comes down to how you tolerate the medication, allowing it to get to the adequate dose range. For Prozac, is generally in that 20 up to an upper end of 80, sometimes even more in special populations. So it is fairly well tolerated, even high doses. That's just a little tidbit on Prozac. I'll be doing more of these, and I invite you to follow along. Thank you. Take care.